Hi, I'm Dr. Daniela Stein. I'm a medical doctor, and I'd like to chat with you about cognitive behavioral therapy in menopause. I'm the author of the international best-selling book, Through Menopause. And in that book, I have a whole chapter dedicated to cognitive behavioral therapy, CBT, in menopause. So, a little bit about my background is I'm a family physician. I'm initially trained in South Africa, then I trained further in Canada, and in Canada I worked in a small town in rural Alberta where we didn't have a lot of access to a psychiatrist. So I did more training in cognitive behavioral therapy to help my patients with depression, anxiety, post-traumatic stress disorder. And that was specifically what I knew CBT was for. At that point, this was maybe in 2010, I did my first course in CBT. There was this overwhelming science that it is more beneficial than traditional psychotherapy. So with traditional psychotherapy, you would go to your psychiatrist or psychologist and you'll talk about your problems. And you can see them every week or every month and really talk about your problems and try to understand and analyze what went wrong in your childhood. And there are many people who had horrific childhoods. And there's a lot of science or a lot of evidence showing us that people with more adverse childhood events are more at risk of chronic pain, of autoimmune diseases, depression, anxiety, cancers. And that was really what it was about, psychoanalytic therapy, to really explore and delve deep down into your problems. But CBT takes a different approach. It spends maybe half an hour on acknowledging everything that went wrong in your childhood. But then it says, but what are your goals? So CBT is not a lifelong thing that you see your therapist every week for the rest of your life. It's typically a 6 or a 12 session, weekly session therapy that you would, with 6 to 12 sessions, see your therapist or your doctor, where you talk about your future. Where do you see yourself? Where do you want to get? So you don't just feel sorry for yourself for things that happened in the past that you can't do anything about anymore. You take ownership of your current mental health, physical health, and you say, where do you want to get? What is your goal and how are you going to get there? So yes, you acknowledge horrible things happened, but where do you want to be 10 years from now? You don't want to be in the same position that you are now. What are you going to do? How do you take control and ownership of your own health? What steps are you implementing to be in a better space than you are now? And so it's really goal setting, future orientated, and then with keys to help you, tools to get there. And then one of the things we do teach our patients with CBT is to recognize and identify our mood, emotions, thoughts. Emotions really last for a few seconds. If an emotion comes up, it's a few seconds and it's gone. But what often happens is that people hold on to that emotion, and you don't hold on to positive emotions because your body identifies that it's not a threat and you move on. But your body does hold on to negative emotions and replay it. So it helps to take a step back, to realize what you're thinking about all day, to stop those thoughts, to replace it with positive thoughts. I often advise my patients to have a gratitude list where you identify something every day that you're grateful for. And when you start thinking those negative things, you're now in a position to recognize it, to stop it, replace it with good things. Very interestingly, absolutely fascinating, I'm a member of the North American Menopause Society, and I went to a conference, and there they explained to us the benefit of CBT during menopause. And I was so, my mind was blown, because it never would have crossed my mind to tell a patient who comes in with hot flushes to come for CBT sessions. But there is an emerging body of advice, a lot of research coming through now, really showing the benefit, and I started implementing it with great success with my own patients, and I want you to implement that as well. So to identify your thoughts when you get a hot flush, typically your first thought is, oh, this is horrible, I'm in front of people at work, I'm going to be red, I'm going to be soaking wet, this is horrible, I don't want to be here. Or when you get a hot flush at night, a night sweat, where you think this is horrible, now I'm not going to fall back asleep. I'm not going to be rested. I'm going to be stressed out tomorrow. I'm going to have to eat more for energy. I'm going to gain weight. I'm going to be tired and irritable tomorrow. Before you start down this very negative spiral, to realize what you're thinking and to stop that negative spiral and to replace it with something positive, and to say, but I only had one hot flush so far, or I only had 2 hot flushes. Maybe I will be able to go back to sleep. Today might be much better than I anticipated. To really break free from the spiral, I really recommend that you find more about that. If you don't find a provider in your area, and you can read my chapter on CBT in my book, if you don't find a provider in your area, that's something that you can really Google and look up for yourself, the role of cognitive behavioral therapy in menopause. The research shows that it helps to improve women's symptoms, that they do experience less hot flushes, less frequent, less severe. It helps for different symptoms, anxiety and depression in menopause. It's very helpful. It's free. You don't have to pay for a provider. You can implement these things for free at home. So I really recommend you look at that. You can look at my previous YouTube videos where I've been discussing everything that I address in my book, other things that you can do, movement, breathing exercises, good nutrition to help you to thrive through menopause. And you can look at my next chapter. The next video that I'm going to record is specifically regarding sleep in menopause. If you can optimize your sleep during menopause, you're going to be fine. That's really the key. Good sleep during menopause is absolutely critical for you to thrive through menopause. I'll see you in the next video.